Again, my name is Josina James. I'm a clinical social worker. I serve as primary clinician here at the STEP Clinic, and I also do a number of educational outreach activities as well. So thanks again for joining us. So many of you may know that STEP is an example of what we would call a coordinated specialty care clinic. Many first episode services do sort of follow this model. And sort of fundamentally what that involves is an offering of wraparound services. So psychotherapy, medication management, health promotion, supported employment and educational services, ongoing evaluation, support and education for families. And then we have kind of this sphere that we call coordination with community supports. That can be a little vague, but it involves generally this idea that providers in a CSC or coordinated specialty care clinic uh, work with and coordinate with all kinds of folks who play key roles in the lives of the young people that we serve in our clinic. So what is coordination? If we consult our good friend Merriam-Webster, it's really this process of organizing people or groups so that they work together properly and well. In a CSC, what this looks like is communicating with and involving in, a fairly fluid and as needed way, both individuals and organizations or entities who interact with, influence, play a key role in a client's life when we're in the role of caring for a client. So why is coordination important? Really what this does is it recognizes when we are coordinating the client as a whole person. So somebody who is not just presenting for mental health needs and needs therapy and medication, right? But also somebody who has basic needs, medical needs, social needs, educational needs. And this really helps us express our concern about them in every aspect of their life, which goes a long way towards building alliance and relationship with folks. And it allows us to really demonstrate our support of and our alignment with a client around whatever their recovery goals are. This is often a really great entry point for providers to engage with a client, particularly newer clients who may or may not endorse problems related to psychosis, but might be willing to, engage with a provider around getting support for various goals, whether that's housing, whether that's school, whether that's work. So today we're going to focus on coordination with schools specifically. Why do we coordinate with schools? So psychosis, we know the age of onset tends to be late adolescence or young adulthood, which really overlaps with, whoop, really overlaps with high school and college years. And so many individuals with emerging schizophrenia function within the role of student. Certainly not all, but we do see that a lot of these folks are in school. Schools often where students with schizophrenia spend most of their time and have key social relationships. And then the school environment, expectations, requirements, goals, these can all have a significant impact on symptoms and vice versa, both in the positive and negative direction. So I've got a number of videos to show you all today, hopefully to keep this a little less dry. And also I think that these serve really as really powerful examples of folks who have experienced schizophrenia or psychosis and also have been students. So hopefully these are going to work for us today.
I was trying to get on disability and I was actually denied it because they said I was too high functioning, driving myself to the court and representing myself and everything like that for the appeal. But it was, I suppose, a relief to understand that what was wrong with me and be able to get treatment. Hi, I'm Allison Diop-Hall. I'm here for the Students with Psychosis conference. So essentially, I started experiencing the negative symptoms of schizophrenia when I was 16 years old. as well as the cognitive symptoms. Like I had trouble in math class, and then it eventually got to the point I had trouble just attending school, and I started skipping a whole bunch. Then at 17, I had my first psychotic break. I thought people could essentially read my thoughts, that I couldn't just function around them. So I just ended up dropping out of school. Then I eventually went back, did it online. Then gradually over until I was 22, I just was struggles going back to school. Then eventually getting out of my parents' home to the point where I could function and everything of the sort, as they weren't as supportive and everything.
Okay, so that was just a brief clip there. I really like to include that video of Allison because, you know, we hear right off the bat that where this first started affecting her was school, right? 17 years old. And that it both affected her school functioning, how she was able to perform at school, as well as sort of her school trajectory over the next several years, right? Kind of in and out based on how her symptoms were doing. So I just want to bring that to life a little bit. So when we think about psychosis in students, there are a number of different ways that psychosis can affect an individual who's in school. These are just some examples, and perhaps some of you have other things that come to mind, and you know, feel free to throw those out in the chat. So, if somebody is experiencing hallucinations, for example, this might be very distracting during class, right? Perhaps they're having trouble kind of concentrating on the teacher. It might be difficult for them to hear what's being taught over the hallucinations, depending on how kind of persistent or loud they are. If someone's experiencing paranoia, that may make them feel comfortable or uncomfortable to sit in certain spots in the classroom, potentially avoiding windows or avoiding the front of the room. They may feel uncomfortable speaking up in class. They may, you know, kind of sit towards the back of the class, perhaps be a little bit less engaged, right? Cognitive symptoms. This one I feel like gets overlooked a little bit in thought disorder, but these are really, really important, especially in the school setting, because they can certainly negatively impact a student's ability to process information, for example, encode, recall, attend to what's being taught, what they're learning, right? Organize tasks and information in a way that makes it sort of easy for them to learn and participate or complete assignments in sort of a usually allotted time. And then negative symptoms can really, you know, for example, reduce an individual's motivation, their energy for both, you know, the academics of school, but also the social aspects of school, right? You know, sometimes it might look to a school who doesn't know that somebody's struggling with psychosis, that an individual is, you know, they're just not motivated, right? That maybe it's sort of like a generic truancy issue, for example. And if we're a provider or a parent, and we know that somebody is struggling with psychosis, this is something we want to make sure that we help the school understand is a separate issue. So, in the school environment, psychosis can look a number of different ways, right? A student seeming distracted, having trouble concentrating, responding to internal stimuli, perhaps seeming suspicious of others, paranoid or on edge around peers, even friends, maybe disengaging from friends or those other students we know they tend to really be relating to, disengaging from class, from extracurriculars, right? Maybe that star basketball player suddenly isn't showing up to practice, or isn't getting along well with, you know, other team players in the way that they used to. We might notice a decline in grades, or again, you know, somebody sort of missing school, having trouble showing up on time, having trouble attending to their hygiene in the way that they used to, perhaps just behaving in ways that we know are, you know, kind of unusual for them, or maybe even a little bit odd. Perhaps when they are participating in class or speaking with peers or speaking with, you know, a staff person at school, what they're saying doesn't quite make sense or is difficult to follow. Maybe they're even, you know, sort of outwardly endorsing some strange ideas or beliefs. You know, maybe they're presenting to the school nurse a lot with these somatic complaints that seem odd or out of the blue. These can all be, kind of various ways that psychosis might present in the school environment. And I really want to point out that students who are experiencing psychosis are at a heightened risk for dropping out. We do not want that, right? We as parents don't want that. We as providers don't want that. We as school staff don't want that. We as individuals with psychosis who are in school don't want that, right? That's not a good outcome. So we really want to make sure that we're paying extra attention to these folks and really getting them the supports that they need. And I'll say a little bit more about that down the road. So there are a number of myths about students with psychosis. I'm gonna just run through a few of them. If folks have others, please feel free to shout those out, or put those in the chat. So some myths. Students with psychosis don't go to my school. Students with psychosis cannot remain in school because of impairment from symptoms on academic functioning. Students with psychosis can't remain in school because of their risk to fellow students. Students with active symptoms of psychosis must take a leave of absence and cannot return to school until all the symptoms have resolved. These are things that school staff have thought at various points, providers have thought at various points, students themselves might have believed at various points, parents might believe about their children, in school. And so these are common, right? These are things that have crossed a lot of people's minds or beliefs that a lot of people have held. I want to try to, really dispel some of these myths. So we know that roughly 3 out of 100 people has a schizophrenia spectrum disorder. That's not even including, folks who may have sort of these sub-threshold psychotic symptoms, right? And the age of onset, again, is typically late teens, early 20s, right? So odds are there are some students in every school who might be starting to struggle with psychosis, if not already having, a diagnosed condition. And that's both, the high school and the college level. Students with psychosis can remain in and or return to school with adequate treatment, with adequate supports and accommodations where needed, even if they're having ongoing symptoms. And this is individual dependent, right? Um, but it is absolutely the case that folks can be in school with symptoms, assuming that they're kind of getting the supports they need and some treatment there. Um, and I want to make a note, complete resolution of symptoms is not always achievable. It's not always realistic for some folks, and it's not even necessarily desirable for some folks either, right? So we don't necessarily want to have that be kind of the benchmark for somebody returning to school. Students with psychosis are not any more likely to be dangerous than the general population, okay? Especially when they're receiving treatment. So that's certainly not, a reason to have uh like a broad blanket of preventing people from being in school when they're experiencing psychosis. And then continuing to engage in meaningful activities, goals, roles like that of a student is a really, really crucial part of someone's recovery, right? So we want to do what we can to help support somebody with psychosis in staying in school. All right, got another video here for you.
I hallucinate all day, every day, and a lot of people think that you can't function if you're having visual or audio hallucinations. And I go to Columbia, I sit in class hallucinating. It's not something that I have to like go in a dark room and just like engulf myself. I'm Jules. I've been a member with Students with Psychosis since 2019. That was when it was just a support group at the Fountain House in Manhattan. And it was like 5 of us. It was so sweet. When I found them, I was 17 and I had just been, I was going through in and out hospitalizations. I was having very vivid hallucinations and a delusion that kept me from using any sort of technology. My parents are very into the stigma, so is my whole family. They knew something was up with me, but nothing really made sense, nothing cohesive. They couldn't figure it out. And so after a few hospitalizations and my interactions with my relatives, they realized, oh, I see now. I hallucinate all day, every day, and a lot of people think that you can't function if you're having visual or audio hallucinations. And I go to Columbia, I sit in class hallucinating. It's not something that I have to like go in a dark room and just like engulf myself. I can just sit there and see eels and lemons and still take notes and remember stuff for the midterm or the final. It's not something so debilitating.
So you gotta love it. Jules is just hanging out in class with her eels and her lemons at Columbia. I mean, amazing, right? And like a really, really great example of how folks can function, right? Can function in school with symptoms. Again, for some people, that might not, be as easy for them. That might be more of a challenge for them. And for other people, they have, sort of established enough coping skills where they're able to kind of manage those two things at once, right? So we really don't want to have like a one size fits all approach in this. We want to be thinking about what each individual student might need. And also, I want to just shout out, these videos are all from the Students with Psychosis conference that was held here in New Haven last year. It is a wonderful organization, started by Cecilia McGow several years ago. She was diagnosed with schizophrenia, I believe, when she was in college, started to experience symptoms when she was quite a bit younger. And it's just a really, really wonderful resource for students to access to get support from other students who have schizophrenia and are struggling or doing well, get tips. They have like live drop-in times when folks can chat with other students. They have a number of resources people can access asynchronously, different levels of support. It really is a wonderful resource. So for any providers out there looking to connect students with supports like this, Students with Psychosis is a great one. For any students out there, please do avail yourself of this. It all should be freely available to any students with schizophrenia. So when we're coordinating with schools, what are we really aiming to do? What's the point? There are a number of goals that we're kind of striving for. So first and foremost, we're doing this because we want to, as best we can, um, make sure that, our client, the student, has the supports they need in school to maintain or even improve their academic and their social functioning, and to minimize the impact of the symptoms on those functional domains for the student. This will often require advocacy and psychoed, both from sort of the clinician perspective as well as a parent, guardian, or the student themselves. And then these needs are often going to best be met via some formal supports like a 504 plan or an IEP. And 504s and IEPs apply to K through 12. Obviously, we're not usually working with folks down to kindergarten, but so for those high school students, and then of course there are accommodations for folks who are in college. So another goal in coordinating with schools is going to be providing or obtaining collateral, right? So, once a school is sort of aware that a student's struggling with something, maybe the accommodations are in place, just making sure that we've got that open line of communication. So if there are concerns that a student or a parent has about the school, perhaps there's a particular class that, is very difficult on symptoms for some reason. Maybe it's something about that class or the setting, and they're having a hard time communicating that to the school. That can be a role for providers, to fill and help communicate that back to the school. If there are clinical concerns that we think the school should be aware of, and maybe there's been a worsening of symptoms or somebody's in the hospital and they need to be excused from school, right? For that period of time, maybe they're just needing some extra appointments. And so perhaps they need to be allowed to leave school a little bit early, a couple times a week. That's something we want to make sure the school knows about. If we have a safety plan in place or certain coping skills that really help a student when they're at school, that can be helpful for the school to know about so that they can help encourage the student to access those during school hours. If there are any med changes, for example, going on that we think, for example, might make a student more sleepy. Maybe they're gonna have trouble getting to school on time for a couple of weeks while their bodies adjust. That can be useful for the school to know about. Maybe there are concerns that the school's having that we as clinicians and providers aren't aware of. I've had it happen a number of times where I'm working with a student in high school and they say things are going great at school, they're doing really well. And then, I speak with the school social worker and learn that, the student's actually failing some classes, right? That's information for us that is, can be helpful to have, particularly if it's because that there are symptoms that are affecting, a student's performance. Positive feedback. Everybody loves getting positive feedback, right? Including the school staff. Um, students with psychosis may not be the run-of-the-mill thing that schools are used to dealing with. So, we want to make sure that we're kind of giving them those extra kudos for when they're really responding well to it. Particularly if they've, helped a student identify an intervention, for example, that helps them get through, or really helped a student through a difficult class, for example. And then if we have a student that does have, those kind of formal accommodations, a 504 or an IEP, for example, providers can and should, where they are able to participate in those meetings. Another goal of coordinating with schools is providing psychoed. So information about an individual's diagnosis, their symptoms, how this may be impacting the student at school, medications and their impact, certain school-related triggers or stressors that the school might not even think about, particular treatment goals and interventions, right? If we have a student who says, look, I'm trying to make sure that I graduate on time, or I'm trying to make sure that I pass all of my classes, or I'm trying to make sure that I get X GPA, right? Good for the school to know about. Appropriate expectations for the student. So we want to help schools kind of gauge what expectations are fitting for a particular student. Not, we don't want them having expectations beyond where a student's at that's going to cause stress, but we also don't want them expecting less than what a student is able to do as well. And then debunking myths about psychosis. That's going to be a really important one, right? Many staff at schools sort of hear this, this idea that students who have been dangers at school have done so because of their psychosis. And, we really don't want to reinforce that, right? We know that that's often not the case, right? Most of the time, not the case with students with psychosis. In general, it's good to assume, or safe to assume, that general school staff are not going to have much psychosis specific literacy, right? Even some mental health providers don't have a ton of psychosis specific literacy. So, just kind of keeping that in mind and just providing the information, right? Providing the facts. So let's get into some of the accommodations that folks can have in school. And we'll start at kind of the high school level. So there are 504 plans, there are IEPs. Those are kind of the two primary formal accommodations we think about. Now, when we're talking about a 504 plan, these tend to apply to students who have some kind of physical or mental impairment that requires some sort of additional support beyond that provided to students without any kind of impairments. What this might entail could be seating preferences, additional time on assignments or exams, reduced workload, a note-taking device, maybe passes to see the school social worker or the nurse or psychologist, perhaps the use of AV devices, maybe an adjusted schedule accommodating for appointments, perhaps excused absences, that kind of thing. Students with 504 plans usually remain in their regular ed classroom with the supports or accommodations or aids as needed. And then how a student can get a 504 plan is a parent, a school personnel, a clinician can request a 504 team meeting, which would involve key players such as the student, their parent, school social worker, psychologist, guidance counselor, outside community provider, for example. Um, and then, the development of a plan, the implementation of that plan is then monitored by teachers with an annual review by the 504 team. Folks can also get what's called an IEP, or an individualized educational plan. These are usually for students who have difficulty learning and functioning because of a disability, a diagnosed sort of ADA recognized disability. And this usually involves a very specific educational plan tailored to the individual student and their needs. This is, a legal document. Schools are considered to have a legal obligation to implement and then demonstrate implementation of these IEPs, right? So these really are kind of that next level. If any of you have ever seen an IEP before, they're usually many pages long, right? Lots of small print, lots of boxes, lots of information, lots of signatures at the end. IEPs are very, very in depth. When a student has an IEP in place, they may be receiving their education in a regular ed classroom or environment. Many schools do strive for kind of the least restrictive environment where possible. Though they could be in a special classroom in a regular education setting, or they may be able to receive their education elsewhere. For example, homebound tutoring. I've worked with folks in the past who have received homebound tutoring. So how does one go about getting an IEP? They can be requested by a parent, school personnel, clinician. The student is then formally assessed, usually by the school psychologist or district psychologist. If they're deemed eligible, there's an IEP meeting. It's developed by what's called the PPT, the planning and placement team, where they really sort of thoroughly go through and discuss the student and what their needs are. And then again, the implementation is monitored by the PPT, the planning and placement team, of which providers, community providers should feel free to be involved in and should advocate to be involved in the development of the plan as well as the meetings. And then there's the annual review. So, sometimes I have parents, for example, ask me which is better. It depends. It really just depends on the student, right? Some students have fewer needs that can be sufficiently met by a 504 plan. Some students have needs that are so extensive as to only be met by an IEP. Some schools or districts are happy to meet all the needs via a 504 plan. I have a district in mind that I worked with many years ago that, I had a young person who had a lot of pretty significant symptoms, and was in high school and was doing, really had a lot of goals around school and needed a lot of supports, but they were able to accommodate that student through a 504, and it worked for them. Some schools or districts feel that, at a certain point, kind of the complexity of the needs can only be guaranteed to be met by sort of implementing a formal IEP. So it really just depends. In the college setting, the landscape's a little bit different. So individuals who are seeking academic supports in college must themselves request accommodations through their Office of Disability Services. Different schools call it different things, and maybe the Office of Student Support Services or Office of Accommodations. But every college and university has one of these offices, and it's the student themselves who needs to be initiating the request for accommodations. So individuals must self-disclose their diagnosis. They need to provide documentation from their provider. They often need to complete a form or an application, and typically those aren't, kind of too burden heavy for the student. They need to have some sense of accommodations that might be helpful, and perhaps that might be developed in conjunction with their outside provider, right? And then also getting the input from the staff in the Office of Accommodations. Um, and then the college may suggest some accommodations and it's really kind of up to the college or university to accept or decline certain accommodations. If the office approves the request, the student then typically is provided with some documentation from the office that they in turn provide to instructors, informing them of the accommodations that they will need. Instructors do not have the option to decline providing the approved accommodations. Okay, so if you're working with a student and they tell you that a professor is giving them a hard time about something, that's not acceptable, right? So that they have to make the accommodations, and the student can go back to their office of accommodations and inform them about that. You know, typically it's not going to be an issue, but if that were to come up, folks should be aware that's not okay. I think the biggest difference between college and high school is that there's going to need to be a lot more self-advocacy from students in college who are seeking accommodations as opposed to high school students, for example.
When I went to psychiatrist for a while, I assumed that I was seeing him for autism. And a few years ago, I was applying for a job, and he written down that I had autism and schizoaffective. My name is Tony, so I end up here this weekend because I go to a organization called SWP, stands for Students with Psychosis. I'm actually diagnosed with two illnesses. So when I was younger, I was first diagnosed with autism, and then when I was a preteen, I became diagnosed with schizoaffective disorder. The autism diagnosis started when my my parents and my teachers found out I've changed. They saw a decline. They saw that I wasn't doing well at school, and then I started act out in school. And then my schizoaffective disorder came about because I started getting worse. During elementary school, my grades started getting better. But then when I went to middle school, my grades started tanking again. And also I started exhibiting strange behavior, like I started running out of my classroom. I started getting angry easily, irritated, throwing things at people, hitting people. But the reason that was happening is because I started having delusions. Like I thought I could time travel. Yeah, I thought I was in an apocalypse. So I started to view people as like they're like villains in an apocalypse. And then another delusion I had was actually I still have this illusion that people could read my mind. Yeah. Then I started to have hallucinations. I started to go to a psychiatrist after my parents saw my behavior change. That was like when I was 12, 13. When I went to a psychiatrist for a while, he didn't tell me I had a new diagnosis. So I assumed that I was seeing him for autism. But then a few years ago, I was applying for a job or a college, and he written down that I had autism and schizoaffective. Yeah. I graduated from college 2 years ago. Well, so this year I got my first job since leaving college. Actually, I had three jobs. So I started working at a recreation center. So it's part time. So then I also volunteered at the library. I I stopped the recreation center job for a while because I got a job at a law firm. Because my degree is in legal studies, and so I'm grateful that I graduated, that I started working. And never thought that I would accomplish that. Yeah.
So another really great example there of somebody who started struggling in school, right? Even for folks who maybe, higher functioning or have more mild symptoms, it is going to be very, very hard if they're in school to not have those symptoms. come into play in the school environment in some way. And Tony's a really great example, again, of how, in spite of, a number of challenges at school, right? It sounds like it was a bit of a long road for him, but he graduated high school, went to college, graduated college, went to grad school, right? Got a degree in legal studies. I mean, that's amazing, right? And we need to, we as providers, we as parents, we as school staff, we as individuals with psychosis need to believe that this is possible, right? Folks may need certain supports, and yet it is still possible. Okay, so we really wanna hold the hope for people. So some common educational interventions for students with psychosis. School-based counseling, right? Access to seeing the school social worker is needed, or psychologist. Medication accommodations. Maybe they need to see the nurse during the day for a PRN, for example. Um, Alternative environments in school to decrease symptoms. Maybe they need to be allowed to take a test after hours in a quiet classroom without other people around. Alternative content or assignments, preferential seating, extra time on assignments, flexible deadlines, excused absences, note-taking assistance, alternatives to public speaking. Maybe they would feel more comfortable doing a pre-recording or a one-on-one presentation. One-on-one educational aids, extra assistance in organization, or help enrolling in post-secondary school. Those can all be, some helpful interventions for folks. So, for the folks in the audience who maybe work in the school setting, for example, and perhaps you're a teacher or a coach or, or a school guidance counselor, if somebody discloses to you that they have a psychotic spectrum diagnosis, or you become aware of that, what are some things you can do? First and foremost, kind of creating a trusting, trustworthy, safe relationship for that student. Validating and normalizing what some of the underlying emotions and concerns may be for them. If they're sharing with you a delusion, and you can recognize it as something that is a delusion, you don't necessarily want to agree with that, right? But I think we can all agree that if we thought somebody was trying to kill us or harm somebody in our family, that would be pretty frightening, right? We can validate that. If a student's sharing, a goal that they have with themselves, they want to, do really well in this particular class, they want to go to this college, really supporting that, letting them know that you're in their corner. You want to help them stay in school, you want to help them do well and reach their goals. Understand that this is often going to be, kind of a treatment reluctant population, right? So maybe this student is coming to you and they're not in treatment yet. There might be reasons for that, right? Maybe they're concerned about stigma. Maybe some of their symptoms are getting in the way of them seeking treatment. Maybe they're worried about what treatment's going to involve. If you're able to be a nice, gentle, encouraging guide towards, helping them seek treatment, that can go a long way towards their overall recovery and their ability to sort of stay in school and do well in school. And you can always, demonstrate that you're curious about their experience, right? You want to know more. You don't want to just shut down the conversation and have them feel othered. You can ask them how they're doing with it, how it's affecting things for them at school, what you can do to try to help support them. We don't want to get into power struggles with folks, right? We don't want to debate the validity of their delusions. You might never convince them that something they really, really believe is true is not true. If somebody tried to convince you that the sky is not blue, I'm sure that would not go over too well. But also be careful about assuming that an experience they're telling you about is delusional, right? If somebody's telling you that they're a musician, maybe they've developed a fashion label, perhaps that somebody's harmed them, don't assume just because they have psychosis that that's not true. Okay. Um, just be mindful of your tone of voice, your body language, your word choice, pace and length of speaking. That can go a long way. folks with psychosis, particularly if they're having active symptoms and you're aware of that. They may already be anxious or on edge. They might, have trouble sort of following a conversation as easily. And they might be, wary of being categorized or treated as kind of crazy or dangerous. So just to be mindful of our language. Again, most importantly, normalization and hope, right? We know that folks who experience psychosis and our students can absolutely stay in school, graduate high school, go to college, do well, go to grad school, right? And we want to encourage that. And we want to help make sure that folks get what they need treatment-wise and accommodation-wise so that they can succeed with those goals. Just some resources for you all. So we've got a handout with some tips for working with schools. NASHBID has a wonderful document on how to support students with psychosis who are in schools. Tip sheets for parents too on how to engage and support their student, their son or daughter or child in school. Connecticut's got a number of great guides out there as well. And again, a big shout out to Students with Psychosis, which is just a really, really wonderful organization, and a really great resource for students themselves who are experiencing psychosis. With all that being said, I will open it up for questions.